Hello everyone. Imagine a situation where Mr. A, an apparently healthy individual, travels in an international flight, sits idle for about 6 to 7 hours, and when he gets up, suddenly collapses and he dies. Sounds all filmy, right? But this can happen in reality because of a condition called as DVT or deep vein thrombosis and its complications. In this video, let's discuss about this DVT in detail. Before talking about DVT, we need to understand what exactly are veins and the venous system of the lower limb. Now, there are a set of blood vessels which carry blood from the heart to the different organ systems of the body. They are called as arteries, and there are different set of blood vessels which carry blood from different organ systems towards the heart. That they are called as veins. Now, coming to the venous system of the leg or the lower limb, there are three types. That is the superficial venous system, consisting of those superficial veins which are just beneath the skin, deep venous system, which as the name suggests are quite deep inside, and the communicating or the perforator veins. The superficial veins transfer blood through the communicating or through the perforator veins into the deep venous system, and from the deep veins they are carried upwards through the inferior vena cava to the heart. Now, there are two important things to note here. One is that these deep veins have what are called as one-way valves, which will prevent the backflow of blood inside the vessel, hence making sure that the blood flows only in one direction, that is towards the heart. The second thing is that the role of the muscles of the leg. Now, these muscles of the leg, to be specific, the calf muscles, when these muscles contract, they basically squeeze the blood out of the veins and they push it towards the heart. So they have a significant role in this forward movement of the blood inside the deep veins, to the extent that one of the calf muscle called as soleus is also referred to as the peripheral heart, because it pushes the blood inside the vein towards the heart. Now, all of us know that blood has a tendency to get clotted whenever there is bleeding. Now, this basically is obviously a protective mechanism our body has to prevent excess of bleeding anywhere. But when this fine balance between bleeding and clotting gets disturbed, there can be really life-threatening complications. The simple examples that we know are the blood clots blocking the blood vessels inside the heart, causing heart attack, or blood clots blocking the blood vessels inside the brain, causing stroke. There is a virtuous triad comprising of three things which are required for blood clotting. First is the endothelial injury. Now, what is that? Endothelium is the innermost lining of the blood vessel that carries blood. In simple words, it means any injury to the blood vessel. The second factor is hypercoagulability of the blood. That is, sometimes the blood itself is more prone to get clotted in different conditions like these. The third factor is the way blood moves inside the blood vessel. That is, it could be very turbulent flow, or it could be stasis of blood inside the vessel without significant motion. Let us now concentrate on the third factor, that is stasis of blood. Stasis of blood or accumulation of blood inside the veins in the leg mainly takes place when there is immobilization of the leg. That is because the pumping action of the muscles, which would otherwise push the blood upwards, is absent. Now, this can be because of multiple reasons like post-operative immobilization or paralysis of the leg, or it can be even as short as immobilization during a prolonged flight journey. Now, this stasis and resultant DVT can also occur in case if there is any damage to these one-way valves which I spoke previously. So these factors can lead to stasis of blood and resultant clotting of blood inside the deep veins. And this is what is called as DVT or deep venous thrombosis. So then DVT or deep vein thrombosis, what's the problem with this? The biggest problem with DVT is thromboembolism. Now what does that mean? If there is a blood clot inside the vein, a part of it may get dislodged from there and move up along with the blood inside the vessel. Now as it moves up, it may reach the heart, that is the right side of the heart, and from there enter the pulmonary circulation or the blood vessel which takes blood to the lungs. This can go and block the pulmonary artery suddenly, leading to collapse and death of the patient within no time. Or sometimes, if there is an abnormal communication between the right and the left side of the heart, most commonly because of something called as atrial septal defect, this blood clot can bypass this pulmonary circulation, enter from right heart to the left heart, and from there get into the systemic circulation, that is circulation to all the other parts of the body, and block the vessels in the brain causing stroke, or block the vessels of the heart causing heart attack. So this thromboembolism is the biggest risk associated with DVT or deep vein thrombosis. So once DVT is present, this thromboembolism can be triggered by any movement of the leg because of the mechanical factors. Now, this movement could be getting up from sitting position after a prolonged flight journey, which will explain the filmy scenario I spoke in the beginning. Or it could be massaging of the leg in the presence of DVT. So quite obviously the most important thing about DVT is its prevention. So let's look at the measures that are taken in the hospital or at home to prevent DVT. Now whenever we suspect that a patient is more prone to develop DVT, it could be because of the prolonged immobilization or the hypercoagulable state of the blood, we take these measures. That is good physiotherapy to keep the limb active so that there is minimal stasis of the blood, or providing them with crepe bandage or the elastic stockings, or providing them with what is called as DVT pump, which basically artificially pumps these calf muscles and leads to forward movement of the blood. Or sometimes when the risk is too high, we may even have to give them with medications which decrease the chances of blood clotting. Clinical symptoms of DVT include swelling in the leg, pain or tenderness, and then the stretched shiny skin, sometimes redness. When DVT is suspected, we ask for what's called as venous Doppler to confirm the diagnosis. In spite of all the efforts that we take, sometimes the patient can still end up developing DVT. Once the patient has DVT, the most important goal of treatment is to prevent thromboembolism. We try to do that by immobilizing the leg so that there is no dislodgement of the clot, or providing them with medications to dissolve the clot or to prevent its progression. And sometimes we may have to even insert a filter in the inferior vena cava so that the thrombus cannot pass through that and reach the heart. Well, sometimes in spite of all these efforts, patients do develop DVT and its complications, that is pulmonary thromboembolism. Now, one of the very basic and important thing that we can do at home to prevent such complication is keeping the ankle joint active. That is, when we move the ankle joint, there is active contraction of the calf muscles, which will push the blood out of the veins and prevent stasis. Now this, in addition to preventing the risk of DVT, will also give protection against what's called as varicose veins, about which we shall discuss in one of our upcoming videos. So these were a few important points about this deadly problem called as deep vein thrombosis or DVT. I hope you found this video informative. If so, make sure you give it a thumbs up, share it with your friends and family, and for more such informative videos, subscribe to this channel. Thank you.